All right, welcome to our high-yield explainer on the fundamentals of pediatric nursing. We are going to lock in the core concepts you absolutely have to know, not just for your exams, but for safe practice out in the real world. So let's dive right in.
First things first, let's start with the single most important rule in all of pediatrics. Seriously, if you only remember one thing from this whole explainer, let it be this. Kids are not mini adults. They are built differently. Everything you do, every assessment, every intervention, every single decision has to be seen through the lens of their unique developmental stage.
And that, of course, brings us to our first big topic, decoding development. This is like the bedrock of peds care. If you can understand this, I promise you everything else is going to fall right into place.
So what do we even mean when we say development? Well, think of it like this. It's a predictable, lifelong process that covers everything. Physical changes, psychosocial changes, how they think. It's not just random chaos, right? It follows these stages we can actually predict. And knowing those stages is how we know the difference between what's totally normal and what's a big warning sign.
And speaking of stages, you've got to have these age ranges down cold. Neonate, infant, toddler, preschooler. These are way more than just labels. Each one tells you about specific milestones, how to talk to them, and what safety risks to look out for. I'm telling you, this is free real estate on the NCLEX, so go ahead and lock these into your brain right now.
Okay, so now let's see how all this developmental knowledge actually helps us read the signs out in the real world. We're talking vitals, key milestones, and those super critical red flags you just cannot afford to miss. Okay, let's look at a toddler's vitals. And this is where things get really interesting, because look how different these numbers are from an adult's. A heart rate of 120? I mean, in an adult, that's tachycardia, right? But for a little one between 1 and 3, it can be perfectly normal. This is such a classic NCLEX trap.
And this image just hammers the point home. Flip it around. A heart rate of 60 or 70, which, is awesome for an adult, that is a huge red flag in a toddler. It could mean they're in serious trouble. You just have to know these age-specific ranges. Period.
Okay, let's run through some of the most common infant milestones you'll see on exams. It's this really cool, predictable sequence. You start with that sweet social smile around 2 months, then the rolling over, then sitting with some help, crawling, and finally taking those first independent steps. This is that normal, beautiful progression we're always looking for.
Okay, so that's the normal path. But what happens when things go a little off track? How do we even know there's a problem?
So this slide really shows you that critical difference we're trained to spot. On one side, you've got all the signs of healthy, happy development. And on the other, the warning signals. These are the red flags we're talking about. The signs that tell us something isn't right and that we need to pay close attention right now.
So it's super important to know the right words for this. A delay is when a milestone is way late. A rest is when development just grinds to a halt. But the one I really want you to focus on is regression. That's losing a skill they already had. You see this all the time when a kid gets sick or has to be in the hospital. A potty-trained toddler might suddenly start having accidents again. That's regression in action.
All right, let's zoom out for a second. To really get why kids do the things they do, we got to look at the big developmental theories. And trust me, the NCLEX loves this stuff, so let's hit the big ones.
This is where all that theory becomes super practical. Erikson's theory is probably the one you'll see the most. So picture a toddler. They're in that autonomy versus shame stage. What's their favorite thing to say? Me do it, right? They crave that little bit of control. So what can we do as nurses? We play into it. We give them simple choices, like, hey, do you want the red medicine cup or the blue one? It supports their development.
And here is another major pro tip that connects right back to what we were just talking about. The stress of being in a hospital can literally cause a kid to regress to an earlier Erikson stage. So that school-ager who was so proud of being independent and doing things with their friends, they might suddenly get super clingy and need more comfort, almost like they're back in an earlier phase. Your job is to recognize that and support them right where they are.
Okay, to round out our theories, let's touch on Piaget and Kohlberg. Piaget is all about how kids think. His idea of magical thinking is huge. It explains why a preschooler might honestly believe that thinking a mean thought is what made their sibling sick. Kohlberg, on the other hand, was all about moral development, how they build their sense of right and wrong. Understanding both just helps you get on their level.
Okay, so we have all this theory, but how does it actually apply to what we do? Let's break down how we put this into practice, at the bedside. Communication is absolutely everything, and you've got to think of it as a two-part job. With the kids, you keep your language simple, you offer choices, you're honest, and you use play to build that trust. But with the parents, it's all about active listening, being comfortable with silence, and being really culturally aware. You're not just caring for the child, you're caring for the whole family.
And this is a golden rule right here. Parent anxiety equals child anxiety. It's almost a mathematical formula. If you can bring the parent's anxiety down, the child's will often follow. So talk to the parents, answer their questions. They are your #1 ally in caring for that child.
Now, part of keeping kids safe means we have to be on the lookout for a really tough topic, child maltreatment. And our role here? It's crystal clear and it is non-negotiable. You have to identify the signs, document only what you see and hear objectively, protect that child from any immediate danger, and then you report. And please remember this above all else. You are a mandated reporter. That's a legal thing. And it means you don't need proof. You don't need to be 100% sure. All you need is a reasonable suspicion. Your job is to protect the child, and that duty starts by making that call. You let the right authorities investigate.
Whew, okay, we have covered a ton of ground. So let's do a quick memory lock and nail down the absolute must-know takeaways from all this for your exam and for your practice.
So let's lock them in. Here are your 4 core principles. Number 1, kids regress under stress, so expect it and be ready for it. 2, the parents are part of your patient, so treat them as a vital part of the team. 3, development is the roadmap that guides every single action you take. And finally, the most important one of all.
And that brings us to the big one. Safety is greater than everything. When you're in doubt, when you're not sure what to do, you always go with the option that keeps the child safe. That is your North Star in pediatric nursing.